Welcome to Environmental and Occupational Epidemiology. I'm delighted that you're here. I'm Dr. Melissa Perry, Chair of the Department of Environmental and Occupational Health at the Milken Institute School of Public Health at George Washington University. I want to tell you a little bit about my background. I got my training in epidemiology at Johns Hopkins, and then I was a faculty member at the Harvard School of Public Health for 13 years before coming to GW. I got interested in occupational environmental epidemiology when I was studying the health conditions of farmers in my home state of Vermont. I came to recognize that pesticides were all around them and they were being regularly exposed to them. I also came to understand by reviewing the epidemiologic literature during graduate school that there were major concerns about the health impacts of pesticides. But when I talked to my fellow farmers that I knew from my neighbors, and asked them about their pesticide exposure, what I learned is they got exposed all the time, but they didn't necessarily understand what the health risks were, nor did they truly understand what they were going to do about them and whether or not they should be concerned. So I thought that a process of education and information would be the place to start. I talked to them about their exposures, I recorded their experiences, and I even took samples of their urine after they applied pesticides and looked at evidence for metabolites from pesticides to really understand what were their levels of exposure. I thought by taking this information and delivering it back to them, that would influence what would happen next. But what I learned is the farmers came back with very important questions. So I'm being exposed to pesticides. What does that mean? Does that mean that this amount of pesticide over the course of this amount of time is going to result in this health outcome? The truth was I couldn't fully evaluate that. I couldn't answer their questions. So that's led me on a deeper path of epidemiologic investigation. It's just an example of the opportunities that epidemiology can provide when it comes to sorting out those thorny and difficult questions to arrive at public health answers. Environmental issues are central to public health. Keeping workers safe in the workplace is also an essential public health issue. As a public health practitioner, this course will give you the skills necessary to navigate epidemiologic studies, to distinguish between different designs, to interpret epidemiologic data, and evaluate weight of evidence. If you are an aspiring occupational or environmental epidemiologist, fantastic. Because this course will give you a solid foundation in study design fundamentals and give you a lot of practice in designing, critiquing, and interpreting studies focusing on important environmental and workplace health issues. The course is also designed to give you a lot of opportunity to talk about research, to hone your research communication skills, and even to have a chance to debate challenging public health issues related to epidemiologic research. So welcome to the course. Let's get started.